All participants will have their blood pressure measured during the pre-enrollment screening in the GoKids assessment room after having their height and weight measured. Participants will be seated quietly for 5 minutes in a chair with their feet flat on the floor, their back supported by a chair, and their arm supported at heart level with the arm unclothed. If their arm cannot be unclothed, their shirt should be a thin material or t-shirt type material. The shirt sleeve should not be rolled up above the blood pressure cuff. During the blood pressure measurement, the participant will watch a video that introduces them to the HbHU study. Next, we'll take your blood pressure measurement. Is there any reason why I can't take your blood pressure on your right arm?
No.
Okay, so the first thing that I will do is measure the cuff to make sure it fits. If you could just place your arm on the table. Great. And now please remember, during the measurement, to keep your feet flat on the floor. Please don't move your right arm, and make sure your back is always supported by the chair. How this will work is that you will sit for 5 minutes to rest, and then every 2 minutes you will have a blood pressure measurement taken, and you'll feel the cuff start to constrict. Please do not talk when you feel the blood pressure cuff start to constrict. While you're having your blood pressure taken, you'll watch a short video that outlines the study. Do you have any questions?
No.
Okay. So I'll start the 5-minute countdown. And now I'll start the video.
Hi, and welcome to the Healthy Body, Healthy You, or HbHU research study.
The default arm to be used for blood pressure is right, unless medically necessary to take measurements on the left arm. You should resize for the appropriate cuff at each visit. Use an appropriately sized cuff, meaning the bladder length encircling the arm about 80 to 100% of the arm, for all measurements. Remember to make a note in REDCap about which cuff size you used, adult or adult large.
Some things to remember about blood pressure measurements. First, identify the appropriately sized cuff for your participant. The circumference of the cuff should wrap at least 80 to 100% around your participant's upper arm. Next, identify the arrow on the cuff and line the arrow up with the brachial artery. When placing the cuff on your participant, try to center the cuff on the upper arm. It should be at least 1 inch above the crease of the elbow or the intercubital fossa. Wrap the cuff around the arm in a circular motion so that the cuff is wrapped in a smooth, snug manner, and so that no more than 2 fingers can be fit underneath the cuff. After checking to secure the cuff and make sure that it is fit in a snug manner, press the start button on the Omron. The Omron is an automatic machine that should be set up to allow for a 5-minute rest period and then take 3 blood pressures at 2-minute intervals. If you ever need to stop a measurement, just press the stop button. This will rapidly deflate the cuff.
At each data point blood pressure is measured, the average of 3 measurements, taken at 2-minute intervals from complete deflation of cuff, will be used. If the first reading for the participant is greater than or equal to 140 for systolic blood pressure, or greater than or equal to 90 for diastolic blood pressure, ask the participant if they know what their blood pressure normally is. If at the pre-enrollment visit, the average of the 3 systolic blood pressure measures is greater than or equal to 140 and or their diastolic blood pressure is greater than or equal to 90, the participant will be scheduled for a physical screening with their primary care provider, or an appointment will be facilitated by the research team with a doctor at University Health Services. The participant will not be told they have hypertension. They will be informed that their current readings are high and that we recommend a follow-up with a doctor before they can proceed with enrolling in the study. If a participant's average of 3 systolic blood pressure measures is greater than or equal to 180 and or the diastolic blood pressure is greater than or equal to 100, the principal investigator, Dr. Jessica Whiteley, will be contacted to talk with the participant. Afterwards, a participant can be recommended to see a healthcare provider or University Health Services for a follow-up prior to participating in the research study. If high readings occur at a time point other than baseline, a similar procedure will be followed. Physician clearance will be required prior to further participation in the study.